All right, I'm going to start our next session. I am Roberta DiBiase. I'm the Chief of Infectious Diseases here at Children's National. And our next session is going to focus on environmental impact on infectious diseases. Now, I can never resist by pointing out that infectious diseases, of course, made it into the first session as well, even though that was on allergy. And we really believe infectious diseases are important in almost every aspect of medicine. But I digress. So let's move on to our excellent panel. We have Jonna Mazet from University of California, Davis. We have Dimitri Daskalakis from the CDC, and we have Eugene Richardson from Harvard. They are all presenting virtually, but I will introduce them as they give their speeches. We did build in 5 minutes at the end of each of their speeches for questions, but we will look at the clock since we're running a teeny bit behind schedule and see how that goes. So the first speaker is Jonna Mazet from the University of California, Davis. She is the Grand Challenges and Chancellor's Leadership Distinguished Professor of Epidemiology and Disease Ecology at the University of California, Davis. She founded the One Health Institute there, and she is active in global health problem solving, especially for emerging infectious diseases, which we all know are very important, and conservation challenges. She was the global director of a greater than 200 million viral emergence early warning project called PREDICT. She developed this with the U.S. Agency for International Development's Emerging Pandemic Threats Program. She's an elected member of the U.S. National Academy of Medicine and also serves on the National Academies of Science, Engineering, and Medicine's Forum on Microbial Threats, the One Health Action Collaborative, and the Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats. I've had the pleasure of interacting with Jonna in other forums, and she is really so pertinent to this topic that we're going to talk about today. So I'm going to turn it over to Jonna.
Well, thanks for having me today. I'm going to stop your screen sharing and switch to mine. And quite an echo for me. I hope it's not coming back to you through my mic. So I'll let the tech gurus, and they've sorted it. It's gone. So it's great to be with you today. And I'm going to talk to you about using a One Health approach and what that means to thinking about emerging infectious diseases and other big problems, especially how that links with the climate crisis. And again, I'm just thrilled to be with you. Thank you, Roberta, for inviting me. I want to say that just about, I guess it's 2 weeks ago now, I was in Canada at the inaugural International Congress on Academic Medicine, and it was thrilling to be there with academic health centers and medical schools from around the world. I believe they had 45 countries represented at the Congress, and their opening plenary or the first full day was on One Health. So we're really seeing a lot of momentum in medicine for looking at One Health. Of course, that's driven a lot by what we've all just been through, but also we're seeing ministers of finance advocating for One Health, the World Bank, along with WHO, advocating for One Health. So I do think it's an important paradigm that we should be thinking about as we think about everything, how we receive and diagnose patients, as well as our research to keep things moving forward. Okay. So when I talk about One Health, I use it, you'll hear people use it in different ways. I use it to refer to an approach of to big complex health problems. And when I say an approach, that means you bring together all of the collaborators that you need across disciplinary lines and across sectors and even things like geographical boundaries. And the idea is we want to achieve optimal health outcomes with equity, recognizing the interconnectedness among people, animals, plants, and their shared environment. And really, I've listed some problems here on the right. I'm going to talk about zoonotic disease emergence and pathogen distribution primarily, but I want to just say it's these influences on the bottom left: human behavior, our culture, our economics and drive for development, and our science literacy and education that are really forcing these issues. And they do that. All of that is creating climate change and changing land use, and those things drive zoonotic disease emergence. And so when I'm talking about diseases that are shared between people and animals, I'm really talking about these diseases that don't jump out and get us, obviously, as you all know. Even the hosts of those diseases, the evolutionary hosts, which are most often wildlife, they're not jumping out and interacting with us. We are changing our behavior. We are moving further and further into previously more pristine areas and putting ourselves at risk. We are going into very remote locations and extracting resources and bringing with us all of our food animals that can mix with the wildlife and amplify these pathogens and even allow them to evolve and change and become sometimes more risky to us. But when I think about climate, even if we go back to this 2005 UN climate refugee map, we are seeing that people are also now the recipient of the problems that we caused, right? And usually the people that are most affected are actually those that are most underrepresented in medicine, in education, in politics and policy. So, we're starting to see these horrible, huge changes. And when you push people out of their home habitat, just like the animals I'm going to talk about in a minute, we stress the people. We often end up putting people into high density and refugees camps. They are then at risk for those high density transmissible diseases. And that perpetuates the problem. If we look at a similar map for wildlife, we see that we can overlay these exact same patterns. Where we're seeing the problems with climate refugees, we're also seeing changes in species behavior, loss of species and biodiversity, and that biodiversity helps provide resilience in the ecosystems that also affect human health. Back in 2009, colleagues and I started to document that not only were vector-borne diseases and their patterns changing, which we expect with climate, right? If we are now allowing the temperatures and humidity and everything else for mosquitoes to be, attractive in higher elevations or in previous colder climates, we have to be ready for the diseases that those vectors can transmit. But we also are seeing changes in animal patterns and a mixing of animals in ways that we've never seen before. The migratory patterns of birds we've been watching for decades, and right now I hate to point out, in case it hasn't come up yet today, that we are in the middle of a pandemic of H5N1 avian influenza in birds. So wild birds and poultry in Africa, in the Americas, we are seeing H5N1, which we consider to be a strain of influenza that we really need to watch carefully. And we've already now seen human cases. And just last week, WHO confirmed a case in a person from Chile whose only known contact was through marine mammals and wild birds, likely not through poultry, which we expect to be the most common transmission interface of these dangerous influenza viruses to people. So I just want us to think about it, and I'm sure I'm preaching to the choir for those of you in the audience, that we can't sit on our laurels and just expect that we'll be ready for what comes next because we just did this amazing Herculean effort for SARS-CoV-2. We in the middle of the COVID-19 pandemic, we had Mpox, right? And now we're getting warning signs for those things that might come next. Maybe this H5N1, maybe not, but we need to be ready. This paper in 2009, if you can look on the left, you'll see that we've given you a visualization of the polar ice cap. And so starting at the top, you can see that the polar ice cap was doing what it's always done, at least in our recorded history, and it's prevented transmission of animals and then their evolutionarily contained viruses in different areas of the world. So we did not have communication between the Atlantic and the Pacific, or the Atlantic and the North Sea and the Pacific. But then starting in 2002, you can see that shrinking of the ice cap all the way down to 2005, where we saw that you could actually migrate through there should you want to. Now, the question always is, do animals do that? Do they start to use new opened up waterways if that wasn't their migratory pattern before? And what we were able to document, because we saw a new virus in the Pacific that we knew about from the Atlantic, but we hadn't been seeing in the Pacific ever before, and now we were seeing it, we were able to go back and put radios on several different species on both sides of that polar ice cap and actually document, you can see with these colored lines, that those species were interacting and they were crossing that previously controlled gap. So this impact of climate change that, again, humans are creating by our behavior, by our land use, by everything that you know about of how climate is being impacted, we're now seeing a completely different world. And of course, we need to be ready for that. Of course, we need to be ready for the things you know much more about than I do. Asthma. Out here in California, we're seeing horrible impacts from wildfires on the health of our populations, and again, more heavily impacting our underrepresented folks. And those are also individuals that tend to not seek out healthcare as often. So we're sort of on the crux of what we're considering a health equity tsunami in the wake of COVID, in the wake of Mpox, and now with the climate crisis. So here's just a few examples of diseases that we're seeing changes in. I mentioned avian influenza. But all of these others are really related to these new uses of land and sea by animals that humans interact with. In fact, on the East Coast, we saw avian influenza in dolphins. In South America, we're seeing avian influenza in the seals. Almost a decade ago, we were able to document in elephant seals around California. We had the human strain of influenza, the circulating seasonal strain we were able to pick up in elephant seals, even though elephant seals are protected and people aren't supposed to come into contact with them. There's certainly the possibility of runoff from land to sea, though these were very at the pelagic time for elephant seals. And so we were looking at actually cruise ship effluent. So those boundaries that we've always considered to be between sort of developed society and wildlife and our ecosystems are basically gone. We should not assume them when we're thinking about human health, that this is an animal disease. We should be ready for all of those. And just to reinforce that, when I started working on emerging infectious disease threats of humans, about 15 years ago, we were seeing on the order of 3 new viral diseases each year in humans, and now we're seeing on the order of 5. And this increase based on analyses cannot be simply explained away as better diagnostics and better surveillance. And so we really need to be thinking about how we are, treating each other and treating the planet, and be ready and understand what risks we're coming into contact with. And I'm actually really pleased to be working more and more with industry, because as we think about business and where business is expanding and looking at natural resource extraction, we need to really be considering what risks that brings. Also, I just want to mention food systems. Again, food systems and the inequities in food systems have differential impacts on health, and including from nutrition that provides resilience to our human populations. And we really need to be thinking, just like we think about mining and other things, we now kind of have to think about food systems as having become an extractive industry, where we really, treat the earth like it will keep giving and giving. And we're finding that that's just not going to be the case. So all of that is related. So human health, animal health, climate, food systems, these things are all coming to a sort of negative head at the same time as we're considering those inequities in our society as well. And I really think, again, if we use the One Health approach, come together, work together, we'll be much better prepared to identify those oncoming tsunamis, like from long COVID, but also what we can be ready for if we're not completely able to forecast what might be next. And to that end, as Roberta mentioned, I was the leader of a more than a decade-long project, which was really designed as a proof of concept as to whether or not we could get ready for large-scale epidemics and pandemics, and could we understand the risks ahead of time and work with communities to mitigate those risks. And I'm really pleased to say that we many of you in the audience will laugh at me if I call a $200 million project a pilot study, but it really was a proof of concept, because we were only able to work substantively in about 30 countries around the world. But in those 30 countries, we were able to have significant impacts that told us, and this was published in Science back before the pandemic, that for about $4 billion, we could actually know about almost every virus that we needed to know about, and its risk characteristics and its risk interfaces, so that we could be prepared and hopefully mitigate spillover risk. Of course, we didn't have the buy-in at that time, because people were like, yeah, I have this long list of needs, and really addressing something that may or may not ever happen is not something that I can do right now. And I'm speaking as a policymaker. And then COVID hit, right? So we're waving the flag. It wasn't hitting the high priorities. And now we know that $4 billion was a drop in the bucket compared to what we ended up dealing with, the trillions and trillions of dollars lost and the millions of people dead. So I'm still advocating that we get ready. We have to do that safely and securely. And we have to work together around and across nationalistic boundaries. So I don't think we will ever be able to eliminate every spillover or every outbreak, but we can be ready for them, know what is likely a risky behavior, increase surveillance and staging of response equipment and things in those areas. And we can prepare our laboratories and our health systems to detect, diagnose, and identify them early, so that we can get to a place where we have the preventions, the therapeutics, the vaccines. And I'm really pleased, and I'll talk to you a little bit about a project that we're doing with CEPI to get to that point. When we started, there were only about 260 viruses that are shared with animals known to make people sick. That proof of concept project I mentioned helped us to estimate that there are probably 500,000 viruses still to be discovered that can spill over from animals to people. Now, not all of those will make us sick or cause a pandemic, but we should be ready for them. We should know about them, and we should be able to identify and watch them in case they do start to evolve to be a heavier pandemic risk. This is how we worked. We worked primarily in this green area, which is what I call the zoonotic pool of viruses available to spill over into our domestic animal population and amplify and change and remix and then spill into people, or to spill directly into people there. And the problem is, we really, at this point, for disease X or that unknown next one, we don't have the ability to control because we're not ready. And so we jump in too late. We prognosticate and we twiddle our thumbs and we wring our hands because we don't know what to do. And you all in the room, together with the groups of people that have been working on this around the world, have the opportunity to jump in and change that. We can understand what's out there and be available to use that for modeling, forecasting, and readiness. We can improve our laboratory capacities, so not just academic medical centers being able to test for disease X, but almost any laboratory and any resource setting, so that we're able to jump in more rapidly and see control benefits. These are the kinds of interfaces that we worked with around the world. And I just want to speak quickly about what these mean in a changing climate. So in the middle there, you see what we call a bat guano harvesting condo. Many places throughout Southeast Asia, especially, people attract bats to their properties so that they can get fertilizer, and some of that guano goes directly onto their fields, and then those foods go directly into the human food chain. And some, like is in the foreground there, if you see that there's guano being dried and UV irradiated. And so we can look at that and say, does that work? We can't just come in and say, stop doing that, change your livelihood, but we can talk with the communities and work to find best practices. Now, as we accelerate climate change and land use change, we're seeing that certain species live more and more comfortably, if you will, or adapt more easily to human habitation. And the bats and the rodents and the non-human primates, where we're finding the majority of these potentially zoonotic pathogens, are those same groups of animals that can live closely with us. The other thing we're seeing as animals use different habitats because of climate change, we're seeing more and more species that normally would be more temperate, but we're seeing them, for example, in tropical markets, or we're seeing more tropical animals in temperate markets. So at the bottom there, we see bats, and they look cooked, and that would be great because that would help us reduce their viral and other pathogen load, but they really aren't. They're just their hair's been removed with a blowtorch. And so that market, has significant risk and is often associated with places like you see in the rest of these pictures and the interfaces where we worked. So what did we do? Well, we worked where I said we'd work. We worked in the zoonotic pool to try and identify potentially zoonotic viruses, but we also worked with humans, both doing syndromic surveillances in the catch basins where we were looking at the wildlife, and doing serologic surveys and working both serologically and PCR-based diagnostics with people like the bat guano harvesters to try and identify occupational risks. And what we did, we ended up sampling about 164,000 individuals in the 30 plus countries where we worked. We started in about 40 countries and ended up working substantively in about 30. And what as far as the proof of concept, we very successfully were able to say, yes, we can detect novel viruses. We detected and diagnosed about 177 coronaviruses, not SARS-CoV-2. We weren't working in that area of China, but we did say, whoa, these coronaviruses are jumping species. We really need to be worried about these for human health. And again, competing priorities faced by policymakers were getting in the way. But we also were able to diagnose of over 200 known viruses in species or locations where those viruses were not known to previously occur, like Marburg. So Marburg, in case you don't know, is a filovirus, can cause outbreaks and has caused outbreaks in places like East Africa, most significantly. We should have been ready for it anywhere where the hosts live. And this is the One Health approach again, bringing in the ecologists, say, where do the hosts, the evolutionary hosts of Marburg live? But the Marburg was not on the differential for places where we found it, like new countries in West Africa that did not know or think that they had Marburg. Now those astute clinicians have Marburg on their differential and list, and they are diagnosing Marburg at the one case level, as opposed to waiting until we have an outbreak. So I'm really excited about that. But most productively, I think we trained almost 7,000 people in the One Health approach, working together with cultural and disciplinary respect and humility. And we worked with more than 60 laboratories in the 30 countries, so they now can do this work. We also were able to identify significant information about the ACE2 receptor and whether or not you need an intermediate host for SARS-related coronaviruses, which you don't if you don't want to read the paper, and able to help to identify the potential host for these coronaviruses in the countries where we worked, including in China. We also were able to say the Sarbeco or the SARS-related coronaviruses were primarily at a huge level being found in rhinophilid and hippocytarid bats. So just as I mentioned before, we were able to look at the actual distribution of those bats there on the left, with a specific species that was particularly interesting on the right, and being able to say, hey, we don't need to just be ready for these up in the Wuhan area of China. We need to be ready for these all across Southeast Asia. And as an example of that, working with farmers, we were able to look in their fields and test rodents for coronaviruses and see in that semi-wild or peri-domestic state that about 20%, just over 20% of the rodents had coronaviruses. But when you move them into the food chain and the market value chain that I showed you with the bats before, of course, just like the climate refugees, the people that are climate refugees, you're starting to concentrate and mix them. In the human case, you're maybe mixing them with different cultures and different people from different countries. In the animal case, you're mixing them with different species and putting them into high density. And we see about a third of them then being infected. And when we get to the restaurant interface, where they are actually being butchered and served at tables, we see more than half of the rodents having potentially problematic coronaviruses for both the cooks and the guests at those restaurants. So just a note to show you the kind of interventions that happened with the people who were part of that PREDICT team. Now, PREDICT, our project was finished in the field, and we were no longer funding the country activities when the pandemic started. We finished the field activities in 2018, but we were able to reactivate the network, and most of the people were working for their countries in places like Tanzania and Uganda. Our team members were on their presidential and prime ministerial task forces because they were the people that in the country who had published on coronaviruses. In places like Nepal and Thailand, our affiliates were the first to diagnose the very first case introduced into their countries. And then they could put their public health teams into action, doing case follows and all of the good public health work. Now, where we failed is we did not plan, and we're not funded to, sadly, plan for the presidents and prime ministers and ministers of health. We engaged wonderfully with social scientists with the communities, but we did not give a playbook and manage up so that our leaders could say, what do I do when this thing hits? And that needs to change because then politics got involved, because without a good, solid, accepted in advance playbook, sort of everything just fell apart, and all the public health systems really were influenced and impacted by that. So working with those communities, and again, bringing in the social sciences, just like many of you probably did with your local communities during the pandemic, we're able to work to give the communities what they need. How do you live safely with bats? We need them as pollinators, but you don't need them in your house. How do you keep them out of your house? How do you get them out of your house if they're in your attic already? And that's been really successful, translating that into over 12 language in written form and delivering it in probably about 100 local languages in community meetings. Okay, so wrapping it up, just what's next is that we actually want to continue to move forward and bring in all the new data that's now being considered, and new viruses are now being discovered by the hordes, which is, I think, great news, as long as it's being done safely and biosecurely. And we did all of our work on inactivated viruses in order to prevent accidents. But we use expert opinion to start to say, how do we rank these viruses? How do we know which ones to do surveillance for? How do we know which ones to make vaccines for? And so we have an app that we started called, and you can get to it at spillover.global, and you can make your customized watch list. Of course, thankfully, the risk paradigm is working, and SARS-CoV-2 is at the top of the risk. But most of these viruses that we rank are novel viruses, newly discovered viruses, so that health systems can be ready for them. So I made, just as an example, a customized watch list of coronaviruses here. We can also identify now, based on that first study, that where the most undiagnosed viruses are, where surveillance should be increased. And for coronaviruses, it's certainly in the Amazon basin in South America. Now, because of development efforts and other things, we're seeing that area shrink and become savanna. That has horrible impacts on climate, and it also has impacts on human risk for disease. So we're trying to actually work in that area to not disrupt the ecosystem and or minimally disrupt it, and use technology to take people out of the equation, so you remove more of the chances for accidents. So we're using bots and drones, and you can see in the upper right, my favorite is the biomimic insect bot that climbs the tree and can even help us to sample at the top of the canopy without cutting down trees, without going into the forest. And hopefully that means that if we identify the risks, we contain the risks, we also protect the ecosystems, which help us to produce oxygen and reduce our sort of path towards this worsening climate crisis. And at UC Davis, I'm thrilled to tell you that we are using the One Health approach now, not just for complex health problems, but we're also using it to really directly go in and be collaborative and try to address the climate crisis, food systems, and how land-grant universities really operate to make them even more solution-oriented. Thanks.
Oh, thank you so much. That was a wonderful overview, and it really brings together a lot of the themes that we were talking about in the first session. So we have not only just environmental issues, but this intersection of where people go, how they are interacting with each other, how they're running into animal populations that they previously didn't. And then this whole concept of equity, that different populations may be more or less at risk for some of these exposures. And this is going to fold really nicely into our discussions tomorrow about the Pediatric Pandemic Network, and moving more onto these themes of how do we do surveillance, how do we stay ahead of the game and not just be reactive. I also liked that if you think about the first keynote address and the address you just heard, the importance of cultural sensitivity when we're implementing vaccines, when we're doing surveillance, when we're trying to do interventions in different populations. So thank you so much.